Radiology is a really good field to go into.
And it's just an exciting profession in that it changes pretty much yearly anymore.
It just keeps the variety in your day.
I just like seeing how the different body parts work on different people.
You deal with people every day.
One-on-one, hands-on time with patients.
You get to see the progress, which is kind of nice to see, you know.
It's a challenge every single day.
You will always be learning throughout your life and being challenged to move forward.
You're never bored.
There's no chance to get bored.
You don't have just one thing that you do. It's not repetition. You have several different things, especially in smaller hospitals that you can cross-train into.
Once you have passed your registry boards, you can go ahead and branch to a different modality. Say if it's CT that intrigues you, MRI, ultrasound, mammography. There's a variety of things that you can do after you've passed your boards.
Radiologic technologists or radiographers use x-rays to take images of a patient's anatomy. We usually go to a 2 to 3 year training, and in that time we learn how to adjust equipment, how to adjust a patient to get the images that we need. I like the fact that there's a technical component to our work as well as a personal one. We learn how to select factors controlling the intensity and the amount of radiation needed for all different anatomy. We do patients of all ages, and sometimes that can be a challenge. We have to work closely with our patients and sometimes their families to get information and give explanations. Communication is a big part of our day. We work with radiologists, doctors that specialize in radiology during certain procedures. We often assist the patient in following the radiologist's instructions, helping them to move into a certain position or giving them the barium to drink for the procedure. When patients aren't able to come to the radiology department, such as in trauma situations, we do images with a mobile unit in the emergency departments. If they are very ill, we may do images in their rooms or in the intensive care unit. At times, we will deal with severely injured patients, and our challenge is to work quickly and efficiently to get the images needed. We learn to adapt to a lot of different situations. Not all patients can move to the positions we need, so we have to adjust the equipment to the patient. Some people don't realize that we also take x-ray images in surgery. For example, we could take a C-arm to surgery for a fracture that needs to be set or a pin placed. They also don't realize that we give injections, enemas, and deal with blood and other body fluids daily. Since any type of radiation has risks, one big part of our job is protecting ourselves and others from unnecessary radiation. We do this by using lead aprons, shields, and collimation, as well as other methods. One more thing to know is that since hospitals are open all the time, there are technologists scheduled for all different shifts. We work weekends, evenings, and nights, and may have to take call, including holidays. I think being a radiographer is a challenging position as well as a satisfying one. No 2 days are the same, and there's always something new to learn.
The things that I enjoy about being a clinical instructor are being able to help new students come out and learn the positioning, the technology, being able to help them with their patients and explain to them why we're doing this certain procedure, how the procedure is done. And this is Jenica. She is our second year student, and currently she is doing a rotation through MRI. What kind of challenges have you faced since you've been in this radiology program?
One of the challenges for me was talking to the patient and actually telling them what I want them to do and giving instructions.
It is very rewarding to be able to see once they graduate and get a job that you've helped them achieve that.
I really liked x-ray, but I wanted to be more involved and learn more about the anatomy and how the body works. So that's why I chose to go on and do nuclear medicine. Just the field has a lot more intricacies about how much you can learn and everything like that. So I just thought it was really interesting, and especially how you get to use radioactive isotopes along with it. It was just a good career choice. To enjoy a career in nuclear medicine, I would say that you definitely have to be an outgoing person. You have to be able to ask a lot of questions, get to know your patients. Definitely you want to know a lot of anatomy. Basically, you want to, get to learn all the different areas of the human body. So you want to make sure, you have an interest in seeing how the body works.
I love radiation therapy because it is such an exact science. It's definitely black and white. It's perfection at its best. I enjoy that daily interaction with people. You know, every single day you get to interact with the patient, and everyone is different. Every setup is different. It's a challenge every single day. I think probably the best thing about radiation therapy too is that it's a team approach. It's not just the therapist treating the patient, but it's the nurse and the doctor, and it's the people behind the scenes that you don't see, and it's the social worker, and it's the dietitian. It's just everyone working together for that patient. Team approach from the beginning, so.
Ultrasound uses sound waves to create an image instead of using ionizing radiation. Common uses of ultrasound would be checking out the internal organs, basically, gallbladders, liver, spleen. In women, you're looking at uterus, ovaries. Men, we look at, prostates as well as testicles, the general abdomen. Babies, right from early in the pregnancy to late in the pregnancy. The ultrasound is tech-driven. It is the technologist that decides that if that image is good enough, if that technologist has imaged the entire organ to the physician's satisfaction or the radiologist's satisfaction. You are their eyes. And that can be challenging. Ultrasound is very difficult to learn, and it takes a while to be proficient at it. But I tell you, it's fun. The challenge is what's fun. I really think that's what is the driving force, is the challenge of it is fun. And it's all on you, which can be both scary and satisfying at the same time.
Mammography is diagnostic imaging of the breast, looking for breast tissue or any types of breast disorders. I enjoy mammography because I have a lot of one-on-one, hands-on time with patients, and it's more personal. One of the challenges of being a mammographer tech is imaging a patient and know that the patient probably most likely has breast cancer, and you got to keep your feelings sort of to yourself. That can be a big challenge.
Things that I like a lot about it is it seems like you get a follow through with the patient. If you're down in the hospital, you see they might break their leg or injure themselves, but you never know what really happens after that. Well, here you get to see the progress of how they go. Sometimes they'll start in a wheelchair, next time they're in a walker, last time they're just walking in. You get to see the progress, which is kind of nice to see. Okay, you can breathe, you can relax. Down in the hospital, you don't get to follow up with that stuff, so it's interesting to see how everybody's different and how they recover. So it is pretty interesting. Some of the challenges are geriatrics. Older patients are sometimes hard of hearing, difficulty standing. You got to adjust on that in a timely manner so it doesn't hurt the patient, but yet you get a good image for the doctor too. So, and also little kids can be very difficult. A little bit of challenge is every doctor has their certain views that they want. There's more than one doctor here on one day, so sometimes you got to remember which views that they want and try to do it in a quickly manner, because doctors don't like to wait.
CT stands for computed tomography.
CT is a more advanced imaging.
It takes small slices throughout the area that you're looking at, sort of like slicing through a loaf of bread.
And I enjoy doing CT just because you get to see a lot more than what you can on a plain x-ray.
The images are very interesting to look at. It does help the radiologist as far as diagnostically, in that he gets a better look at the patient's body this way. The most challenging part of computed tomography is if a patient does not hold still. You get blurry images, so you need to get through that area of the body relatively fast. In CT, it doesn't take near as long as, say, an MRI. An MRI takes 45 minutes or longer, where a CT, generally, you can get the patient in and out of a CT scan in 20 minutes.
MRI stands for magnetic resonance imaging. It uses a high magnetic field to produce an image, kind of like CT, where the image is like what we call a cross-sectional image. We're actually be able to see inside the patient. The difference between CT and MRI is that CT would use radiation, whereas MRI uses a magnetic field to align the atoms in your body with the magnetic field itself. So we can take different types of images of all different types of body, mainly imaging the soft tissue, the brain, the bone. If you're looking for a certain cancer or tumor in a patient, we can see that better under MRI than we could on CT. We can see the well-defined edges as well as the enhancements of the tissues. If patients are claustrophobic, we have an anesthetist or a nurse anesthetist come and we put them under so that they don't have the anxiety from the claustrophobia, that they are totally under the whole entire time. So that is a bit of a challenge when we have to work with someone who is unable to move.
Bone density is where you come in and we use low doses of radiation to assess your hip and your spine. And what we're looking for is calcium in your bones to know what your bone mineral density is and to evaluate you for your fracture risk. My favorite part about this is that we can have the patient laying on the table. There's not a lot of noise. There's not too much going on. So I'm able to sit and get to know the patient and have some time with them more one-on-one rather than us being in a hurry.
Many careers have a very definitive career ladder, but this is not the case in radiology. However, that doesn't mean there isn't opportunities for growth and advancement in the profession. After the initial 24 months in an accredited program and successful completion of the National Registry radiography exam, the new graduate can be employed in the field. You can stay in general diagnostic X-ray or specialize in one or more of the clinical areas ranging from computed tomography, magnetic resonance imaging, ultrasound, nuclear medicine, radiation therapy, interventional X-ray, cardiovascular, mammography, bone densitometry, and physician assistant. Some of the advanced modality opportunities are possible through on-the-job training, while others require additional education. Other career opportunities include management, leadership and budgeting of personnel, teaching, inspiring new generations of radiologic technologists, sales and marketing, medical supply companies and vendors of X-ray equipment and equipment services, and equipment application specialist, which involves training of staff on the features of new equipment, and PACS administration, picture archiving and communication systems, computer networking and database support.
Our main role is figuring out what's wrong with people. We do some therapy, but mostly it's working with imaging technology to diagnose people's problems so that other groups of physicians can then work with them to address those issues and hopefully cure them and make them better. Basically what I do is fit pieces of the puzzle together to try to come up with an answer. So I'm using the clinical information, the patient's symptoms, the patient's findings, the patient's laboratory, their imaging findings, and I'm trying to narrow down and or precisely pinpoint what's wrong with them. So basically I'm a sophisticated problem solver is what I really am. First of all, it's a 4-year degree in an undergraduate institution. Then second of all, you go to medical school, and so that's another 4 years. Okay, and then in the case of diagnostic radiology, it's 5 years after medical school.
To become a radiologic technologist, you must be accepted into a 2-year program. Generally, you are required to have some college courses before you begin. While you are in the program, you will actually work with experienced technologists and perform X-rays on patients under supervision. Besides working at a clinical site, you will take a variety of classes, including anatomy, positioning, physics, radiation biology, and some safety. After completing the program, many technologists choose to continue their education in another imaging area, such as ultrasound, CT, or even MRI. These opportunities will require additional education and or on-the-job training as well.
To
To be a radiographer, you have to be a well-rounded person.
High school students, I would say to concentrate on your maths and sciences.
A lot of anatomy.
We do a lot of physics. Every modality has its own physics.
You have to have computer knowledge, you have to have people skills.
You're dealing with people and their families.
It also is very personal.
I would say that you definitely have to be an outgoing person.
You're not just pushing buttons.
The great thing about medicine is there's always something new coming out, there's always new research going on, always new technologies coming out, always new ways to do things. So it's always stimulating, it never stays stagnant.
If you like variety and you like different types of people of all ages, this will be perfect because no day is going to be the same. You're never going to have the same patient, the same day, the same exam. They're all going to be different.